Welcome back to Steps to Health podcast. It is just the beginning of March now, and it is actually Liver Health Awareness Month. So let's talk a little bit about that. My name's Jocelyn. If you haven't been here before, I'm a nurse working in Canada. But let's talk about you. As I mentioned, March is Liver Health and Colorectal Cancer Awareness Month. Morning, we will be talking a little bit about poop. Don't worry, your secret is safe with me. Everybody poops. As it is also Nutritional Awareness Month, let's talk a little bit about flavanols and how they help your brain remain healthy. But before we get into that, what is your liver? Let's get to know this friendly fella that lives in the right upper quadrant of your abdomen. Your liver is your friend, and it is incredibly vital to your overall health. You may have heard that the liver can regenerate itself, but it's not magical. Years of abuse to your liver can impair its ability to heal itself. Damage to your liver can happen through over-the-counter medications, prescription medications, a poor diet, obesity, hepatitis infections, uncontrolled diabetes, and, of course, alcohol misuse. Two main over-the-counter medications that can contribute to liver damage are acetaminophen, also known as Tylenol, and diclofenac, also known as the topical gel Voltaren. Ask your pharmacist how to properly use medications, even those that are over-the-counter, just to make sure that you keep that liver of yours very healthy. Your liver plays a large role in digestion, the protein synthesis, and detoxifying your blood. An unhappy liver can cause issues with every system in your body. It stores glycogen, minerals, and vitamins. It plays a role in maintaining sugar levels in your blood. It can store glucose. It can manufacture glucose. In fact, some oral diabetic medications work to suppress the liver's ability to either release or manufacture glucose. And in that way, it helps reduce the overall glucose level in your blood. The liver also produces bile, which aids in the breakdown of fat during digestion. The liver also plays a role in producing proteins in the body. And proteins do everything. Some notable proteins include albumin, which plays a role in transporting hormones, vitamins, and drugs throughout the body. The liver also plays an incredibly important role in detoxifying your body. As you can guess, if your liver becomes unhealthy, the body will absolutely suffer. Take care of that beautiful organ of yours. It does a lot for you. And because the liver plays such an important role in many of our body systems, there are countless signs and symptoms that could be named. But let's just go over a few. Pale-colored poops or bowel movements, dark tea-colored urine, itchiness that just can't seem to be satisfied, fatigue, nausea, vomiting, yellowing of the skin or the eyes, pitting edema, swelling of the skin that when it's pressed on, it sinks in. That's edema. Indigestion is also another one. Now, these are many signs and symptoms, but they're not all specific to liver health. It can be a sign of other things, so please see your healthcare professional, of course. And don't be shy about what your lifestyle is when you're talking with your healthcare professional. We've seen it all, and we are ready to help you become the healthiest version of yourself. Colorectal Cancer Awareness Month is March, as we've already established. Colorectal cancer is cancer that affects the colon or the rectum and is one of the leading causes of cancer-related deaths in Canada. Although it can affect people at any age, it is most common in those over the age of 70. If you are 50 years and older and are at a low risk of colorectal cancer, screening can be performed every 2 years by a lovely stool sample. If you're a higher risk for colon cancer, though, I highly recommend that you talk with your doctor about when to start screening and what tests might benefit you the most. You might be considered high risk if you have a family history of colorectal cancer, a personal history of it, if you've ever been told you have polyps in your colon or your rectum, if you live with an inflammatory bowel disease, or if you have inherited conditions such as Lynch syndrome or FAP. If caught early, the treatment options and interventions can be very promising. It really pays to pay attention to your poops. Any change in bowel habits can be an indication that something is going wrong inside of your body. So pay attention to your bowel habits and don't be shy when talking to your healthcare professional about it. As I said in the beginning, everybody poops. Lastly, I'm just going to touch a little bit upon Nutrition Month. And I'm only talking about this particular thing because I just read an article on it and it seemed kind of interesting because dark chocolate is awesome. And it is full, or some of them, are full of flavanols, not flavonoids. Flavanol is a type of flavonoid found in vibrantly colored fruits, berries, and vegetables. These amazing little metabolites have neuroprotective effects in our brain and can suppress neuroinflammation. It can increase blood flow and has the potential for inhibiting neurodegeneration. Some studies have found that a good diet rich in flavanols can promote improved cognitive functioning. So go ahead and dive into that dark chocolate, those leafy green vegetables, the berries, citrus fruits, soybeans, and even apples. If you've made it this far into the podcast, thank you very much for joining me once again. That concludes this week's episode of Steps Podcast, also called Steps to Health Podcast. I'm not too sure what I'm actually going to call it just yet. If you have any feedback for me, if you want to share your personal experience with liver health, colorectal cancer, or any nutritional tidbits that you find pretty interesting, go ahead and leave me a comment on my YouTube channel or my SoundCloud account, both of which are called Steps Podcast. You can also find me at stepspodcast.com and Steps Podcast on Twitter. I'd love to hear from you. Let's get a conversation going, and I will see you next time.